Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
Hey everyone, welcome back to the Wild Health Podcast. I'm your host today, Carl Seeger. I'm a physician for Wild Health. And today we have Kalin Johnson here. Dr. Kalin Johnson is known as a neurodivergent pharmacist and is a clinical pharmacist and healthcare advocate, as well as a wellness coach and neurodivergent mentor. So her personal experience with mental health and challenges and chronic illnesses include undiagnosed ADHD, autistic traits, and hypermobile EDS or Ehlers-Danlos syndrome. All these things have fueled her passion for providing personalized care and to address those unique needs for her clients and people dealing with these sort of disorders. So Kalin, it's really good to have you back here. It's good to see you.
Thank you.
It's always a pleasure.
It's great to be back.
Yeah, it's I wanted to kind of talk about communication with people with neurodivergence as well as specifically autism today, and as well as some like comorbidities and sensory differences there. But maybe we should talk about like maybe epidemiology around this. So what does it look like? I think the common stereotype is that when we talk about autism, people think about children, and they think about somebody else, and not them, and they think of people who have really severe disease that are, that require a lot of assistance, and not people that are interacting with on a daily basis. So
Yeah,
I was kind of hoping you could kind of dispel that, and then
totally.
talk to us more about that.
Yes. Well, and that is the exact issue with how we tend to see autistic people is really through the lens of their support needs. So that is often then how we experience the autistic individual, not how they experience themselves. And that's been the issue when it comes to identifying autistic people who are maybe lower support needs, or less obvious support needs. So that would have been like myself. Like I was not somebody who would have been easily identified as autistic. I was not diagnosed until I was in my like early 30s. Even though when I was diagnosed, and it was brought up to me by my psychiatrist that, hey, I think maybe you should be evaluated for this. You might be autistic. I was not surprised at all, because from the time I was in my teens, I used to say around my like sensory sensitivities that, hey, it's like I'm autistic. That's all I knew about autism at the time, and I knew I related to that, and that's all I had. Yet I knew though I had friends, these like kind of classic things that we think about with autism. I could make friends. I had social connections. I was good in social settings. Like all these classic things that we think about autism are really just one nuanced version of how we see autism show. And generally that's in young boys. That's who we've studied.
Yep.
That's what we know that looks like. That can look very different in especially girls, but even in boys that can look very different, especially when it comes to autistic people who are considered then high masking. So have that ability, have probably that like hypersensitivity around human behavior, situations, really understand that, have that social awareness. So while I'm good in those situations, I had to laugh when I told my own PCP that I had been diagnosed with autism. She stopped and she goes, "But you're the best communicator I've ever interacted with." And I said, "Right." And that's not normal either. So that also hyper awareness of having to do so is a trait of that. So you have to look all of it really as a spectrum.
Yeah, so talk to me about communication styles and
Hmm.
how they vary within the autistic community, and then
Yeah.
maybe share some specific examples of how these might look in everyday life. But maybe before that, what do you think the prevalence is of? I know the prevalence of like before we get into communication styles, I know
Hmm.
the prevalence has been increasing, and whether that is because there's multiple reasons of why people think that is. Um, but the question is, what does that look like now, and what do you think it's going to look like in the future as far as number of people diagnosed with autism?
Right. I think those numbers will be much, much higher. And I think what we're really seeing, especially in people, again, identifying themselves as like relating in a lot of ways to the autistic diagnostic criteria, is again through that area of sensory sensitivities and sensory processing. And we know when we look at the autistic brain, like postmortem, that the area of sensory processing is where autistic people differ the most from non-autistic people. And one of the things that's really interesting about that is when you look at the area of sensory processing and you look at the brain in somebody who's not autistic, that area is wired very similarly from Joe to Fred to Bob. It all looks pretty much the same. But when you look at an autistic brain in the area of sensory processing, not only is it differently wired from that of the neurotypical individual or the non-autistic individual, but they're also different from each other. So when we also talk about communication differences, sensory differences, all of that, and there's this common idea from autistic people that we feel very alien, can feel very alone. That's extremely valid because the way our brains are wired in that area is so different. Now, what then I think will end up kind of further encompassing this diagnosis and why we are seeing more and more people relate is because of also this knowledge of like what makes us different is that area of sensory processing. So if anyone has these differences in how they process their sensory environment, they're going to likely relate to some of the diagnostic criteria or some of the attributes of an autistic individual and may then also echo some of the same communication differences that we see in autism.
So, can you give me some examples in how this
Mhm.
may look in like
Yeah.
everyday life?
Yeah. So, a number of different things. So one of the things I always would get pointed out in my speech is how it can be very like I'll use very like medical words, like even when I'm in non-medical situations. So using words that are not always quote socially appropriate for the situation. I had to read Shakespeare when I was like 14, and I uh in one of the passages it said something like "ye who," and I started using "ye who" in like normal like conversation. Everybody laughed at me, and I like did not understand why. I was like, "Well, that's something that you say, right?" Like I used it correctly. Why would we laugh at that? So again, that would be the logic, right? So logic in communication is also a really major thing that we'll see with autism. Um, One of the main things that we see different, especially when it comes to communication and decision making, is the criteria, the order within which we use these criteria to make decisions. So everyone's going to use information, social context, and their feelings to make a decision. But the order within which we use those is different for neurotypical people versus autistic people. So, neurotypical people tend to make decisions feelings first. That's going to first drive the way that they are going to assess the situation. That immediate feeling is going to drive that. Then there's going to be the social context of the situation. Like, what are people going to think of me? Like, what's going to matter here? And then last is the information. And that all happens very quickly. It's not like obvious, like only feelings driven, but it's a very fast boom, boom, boom. Autistic people will generally make decisions information first, which is why we're very logically centered. So even if something could be really painful for us or difficult. If it's logical, we're like on board. So ours is
Mm.
going to go information first, social context second, feelings third, which is why there's kind of this old idea that autistic people are kind of like emotionally stunted. Um, but it definitely comes more from this place of we just have a different order within which we communicate and make decisions.
Do you think there's a barrier in using that second step, that social context, more like how much they're leaning on that as their second step
Mhm.
of that they're bringing into decision making? I mean,
Mhm.
certainly, my gut would tell me they're not using that at all
Mm.
at
Mm-mm.
times, and it depends on the extreme nature of their uh,
Mhm.
yeah, how their brain is wired. But
Yeah.
like, yeah, I guess talk to me about that.
Yeah, so I think this also you see this fall into kind of two different camps. So it's also remembering that, when we think about sensory differences, we have hyper and hyposensitive. This comes also to things like social awareness, right? And like behavioral social context. So like some autistic people are very hypo aware, some are very hyper aware.
Mm.
So the classic ones you think of again are those like hypo aware where they're just like not catching on to that social context. And usually what they're not catching on to is the nonverbal communication. Nonverbal communication for autistic people is very hard for us to know or to some again, if you're hypo aware, you likely don't even notice it. But for those of us who probably be like me, where I'm hyper aware, I will notice usually changes in somebody's physical communication before they even do, but I don't know what to do with it. I don't necessarily always know what it means. I know sometimes what it means, but not all the time because sometimes there's such small little changes in physical communication that can make that difficult. So the social context can either be they're either not aware of it or they are aware of it, but they don't know what to do with that information. In part because we have very different physical communication. So, like lack of eye contact usually is seen as like maybe you're being dishonest or maybe you feel unconfident. But
Mm.
for people with autism, that's generally not something that we do to connect. And so that can be read into then as something that, like, yeah, we're not paying attention, we're not listening, or we're not being truthful, when really a lot of times it stems from things like social anxiety, or it's really hard for us to focus. Because we tend to get really distracted by other things. Our brains only work well when we are kind of like narrowly focused. So sometimes it's purely just that. So you'll see both.
So are we seeing differences postmortem or on, I guess, on like SPEC MRIs or on those uh, those autistic people with that are hyper aware versus hypo aware? Like, do you know that?
Yeah, not that I'm aware of. I don't think that any of
Okay.
that's been actually identified yet. That would be really, really awesome. But I think generally in socially and societally, it's just been easier diagnostically to identify those that are hypo-aware, again, because you think about so often, diagnosis that involve, like, mental health tend to be about how, again, others experience the person, not how they experience themselves, and so that's why you see those hypo-aware ones, 'cause they're very socially then they don't blend in, where the hyper-aware, it's like, "Oh, this is so great, they're so sensitive," or they're like, a lot of my symptoms were highly, like, validated in me,
Mm.
all growing up as, like, these are great things, but they were still so pendulum swung to one side that it still wasn't normal. My symptoms fit into society a little bit easier.
Yeah. Yeah. So I kind of I think it would be great if we could figure that out because this is
Yeah.
something that with all like mental health disorders, I feel like there's an over grouping of symptoms together, but
Yes.
that and if you don't fit into that box, then it's like, well, that's not exactly what's going on. But and this is obviously a big autism is like a huge like area where this happens in.
Yeah.
So sensory differences is sort of the hallmark of autism. So
Mhm.
can you describe how that might manifest in different individuals
Mhm.
from all across the autism spectrum?
Yeah, yeah. There's a quote, and I don't remember what the physician's name is, but it was from a provider, and he said, "If you have met one person with autism, congrats, you've met one person with autism." That again, like we're all so incredibly different, so this can look uh, massively unique and nuanced, which is why, like even in my own practice, I only really work with patients one on one because it has to be so nuanced to them because it is so different for each of us. And so for patients when they're hypo or hyper aware, or hypo or hypersensitive, that can be different for each type of sensory experience too. So you can be um, hypersensitive to smells. But then you can also be hyposensitive to touch or motion. So somebody who is hyposensitive to touch and motion, they may seek really firm touch. They may want to, you'll see sometimes there's a girl who's on TikTok who's autistic and she is hyposensitive to physical touch and physical motion. And she loves going to theme parks and just going on spinning rides and spinning constantly. Or you'll see the kids in chairs, like just like spin like viciously so that you're like, God, are they
Yeah.
gonna get
You
sick?
think
Like,
somebody's gonna puke
yeah,
for sure.
exactly. Exactly. Or you have like me who then is like really hypersensitive to that. And so like I can get really anxious if I get bumped. Or the way clothes feel on me, or I get motion sick really easily. Like everything with touch and motion, like I am just like hyper attuned to. Um, One of my biggest sensory sensitivities is the wind, which is also like really hard again when you're coaching or like working with like autistic people. Like I'd have people tell me like, "Hey, go outside, like you'll relax, whatever." And I'm like, if there's a drop of wind, I will not because I will feel it on every piece of me and it will cause me like a ton of anxiety. I tend to go mute outside. Talking takes energy. And so autistic people we tend to then when we are hypersensitive are using a lot of distress tolerance to tolerate any of those things. So we tend to lose then other forms of communication during that time when we are in these high stress environments. But there's high stress environments that may look totally benign to other people, but to us, extremely stressful. Um, so
Y-
some
y-
examples.
So yeah, okay. I mean that's super helpful. So I mean, we're talking about different sensory areas. So we're talking about visual,
Hmm. Yep.
smell and taste are usually,
Hmm.
strongly correlated, but touch,
Yep.
um, and auditory is, a
Yes.
well-known one,
Yep.
where just in is there like talk about like auditory a little bit around like
Yeah.
pitch and because from my understanding is like some sounds are actually like repetitive sounds can be great and actually super helpful, whereas something that seems like it would be, really or just becomes really annoying and toxic and almost physically painful to an autistic person.
Yes, 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 yes. And we do know actually the ones that do hit the sensory sensitivities of an autistic person that it actually does register in the brain as pain. So the pain receptors light up when that happens. So when an autistic person is like covering their ears in pain, like they are really experiencing pain with that. So again, this can be a bit unique for each person, but a lot of autistic people struggle not always with volume of noise, but competing sounds. So multiple sounds at the same time. So if you have the TV on and you're trying to talk to them and the dog is barking and you hear a car driving by outside and the neighbor's mowing their lawn, the autistic person's going to have like a total sensory overwhelm meltdown. And a big reason for this, so we think in a way it's called monotropic thinking, where we tend to we always want to hone in on something very specific. So if you had a group of rocks in front of you and all those rocks were different colors, somebody who's not autistic would go up, look at those rocks and be like, hey, great, groups of colorful rocks. Cool. Like, move on. The autistic person would walk up to those that group of rocks and say, hey, colorful rocks. Oh, wait, look at this purple one. Oh, look at this side of this purple one. It's actually really smooth. Like we're always our brain wants to like hone in on these extreme details. Again, we tend to be very detail oriented, but when there is too much detail, so too many sounds, too many sensory things to process, it's total shutdown. So one of the things you mentioned then too was like the repetition. So repetitive sounds, especially the term you'll hear a lot is echolalia. So
Yeah.
we tend to have this want or ability or the stim to want to repeat sounds, especially ones that I honestly, they're ones that just sound nice to us, that have a nice ring to it. So like we will repeat movie um, quotes sometimes or repeat an accent. That's something that I tend to do a lot. My sister is autistic as well, has done it in front of people and not even meaning to.
Lots of
But
lots of
yeah,
Australian accents and
yep.
British accents in your
Nar,
house.
yes. Uh,
Yeah.
yes. That is exactly what that ends up sounding like. It sounds like we're just like my sisters and I will just be like speaking in movie quotes like back and forth. But it's often just again that repetition to the
And
ear is
listening to the same audiobook over and over and over
Mhm.
and over. Yeah.
I've watched the same movies since I was a really small kid. One of my favorite movies has always been Meet Me in St. Louis.
Never
With
seen it.
Judy
Sorry.
Garland. Oh, that's
Very
okay.
sorry. I
Saw
didn't know
it.
what you were gonna say. I didn't know where I was like
Yeah.
Ghostbusters. I
Yeah,
don't
I
know.
know.
I was thinking
Yep.
Teen Wolf. I don't know.
Nope, nope.
Okay.
Yep.
Yeah.
Old movie from the 40s, 1940s. Saw it when I was like 2 or 3 years old, and I've pretty much been watching it nonstop
Or
since. I can quote pretty much the whole movie, but like
yeah.
so one of the thoughts with that with autism is that our world, because of this heightened attunement to the sensory world around us, everything feels chaotic all the time. So we find comfort in the familiar. We find comfort in the things we know because it can be really stressful and overwhelming for us to have things that are unfamiliar. I don't know if this movie, if I go see Twister, if it's going to be too loud. I don't know if it's going to be too visually overstimulating. I know from time I was little that Meet Me in St. Louis, for whatever reason, like hits for me in all of this criteria and comforting to turn it on still to this day. I just had a baby 2 months ago and we already watched Meet Me in St. Louis for the first time. She didn't watch it. She just listened to it. But like, but that's comforting to the autistic person. We're also known to eat sometimes the same foods over and over again. I've been eating the same thing for breakfast for probably like 8 years now. And I don't see that stopping anytime soon. Um, but that's helpful to us.
So what can you talk about what there's a concept called the double empathy and the triple empathy problem. You want to talk about that and how that helps us kind of understand um, mutual struggles between autistic and non-autistic individuals?
Yeah. So this is something that, especially when it comes to people who are autistic trying to get help from their healthcare providers. So, what we tend to see then is we know that a patient generally is going to have a hard time understanding maybe the way that their doctor is presenting information and vice versa, the doctor understanding the patients. There's this double empathy problem back and forth. But with the autistic individual, you also now have to throw in autistic communication into play here. So you have the autistic individual who's trying to understand and speak like people who are not autistic and understand those social behaviors. And then they're also trying to understand the medical side of things. So there's this triple empathy problem. And then even from the provider standpoint of them thinking, hey, okay, you're a patient, just kind of almost assuming this like non-autism way of communication when really things need to be communicated in a way that is helpful for a patient, but not just that, but to an autistic patient, which is it's like speaking another language.
Hmm. So how do you it like with that? How would in your experience, what's the best way for a non-autistic individuals to adapt their communication to autistic individuals? Not just in the healthcare setting, but like,
Uh-huh.
my perspective is there are way more people that have sensory processing or neurodivergent type picture and autism spectrum disorders
Yeah.
in the working population in your in at your workplace,
Yep.
in your home,
Mhm.
that, people don't realize, but they're the ability of individuals to understand that and then adapt their communication style to kind of make a better relationship, going forward with that person and being more successful in your relationship with that person is pretty critical. So what's your
Yeah.
experience around that?
Yeah, and I think I just wanna hit on exactly what you said too, that, like, this really does, apply to people outside of the autism diagnosis as well. So if you also just feel like you communicate best in some specific way, like, these type of things are gonna be helpful for you too. So things that I usually communicate when I'm working, especially a lot of times with other providers or sometimes with even like partners or spouses of my autistic patients that they themselves are not, things that like we'll talk about are one is like assuming that your autistic patient that they notice your body language, but they may not be interpreting it correctly. So you may be as a provider, maybe trying to make subtle hints of like, hey, this is done. Like, I gotta go. And then you're a autistic patient keeps asking questions, they may not they may have noticed it, but they don't necessarily know what that means. So be clear. Like it's usually socially can be seen as rude to just really kind of to state how you feel or to quote like state the obvious. Generally, those things are not obvious to us, and we usually see that very as like helpful and kind when you do again just state the obvious or just say it very bluntly. We tend to do that in reverse. So don't hit at or imply things. Use very precise language. Um, tell us how you feel and why, if you know. So why for a lot of people, like the why doesn't matter, but for us, we're always trying to connect. We're trying to understand, trying to pattern. So if you say, um, I'm mad that you're not being compliant with your medications, like to your patient, they may not understand the why. Like, why does that make you mad? Like, why does that matter to you? They may not even see that as a big deal. Like, it's my meds. Like, why would that upset you? Just things that, again, that you think of as obvious, likely to an autistic patient is not. Um,
Let's be
a
clear, Kaylin, I don't ever tell people I'm mad about them not taking medications. Mm,
That too.
it's not
That
really
too.
that's not
No,
really
no.
I'm not
Hey,
that
well,
paternalistic.
neither am I. Well, I always say again, like, the behavior exists for a reason, right? So if that is
Yeah,
happening, then
but, like,
maybe it's not working or we're having trouble with access to it.
we
Like,
like to be curious about what the barrier is to taking the medication.
exactly that.
Yeah.
Exactly that. Yeah. And one of the other big ones that I also always like for non-autistic people to know is don't expect our facial expressions and body language to match how we are feeling or how you expect us to feel. So we may look really flat or may look like we're or you're having a hard time being like, hey, are they getting this? Or are they enjoying being, do they like working with me? Are they happy with me as a provider? Don't judge that based off of our body language. Feel free to ask us. And please trust our words more than our body language, which is not necessarily true for neurotypical people where body language is a
Yeah.
massive amount of communication.
Where it's
Mhm.
when you're having that feeling of like, "It seems like you're unhappy with me, but you're saying something different."
Yep,
What
exactly.
with this is something that I'm, clinically run into in my life and like several times, um, probably infinite number of times it feels like, but also like in my everyday life where you interact with someone who it takes you a while, but you're realizing there's a barrier there, I think. So there's the clinical side where I'm like, something's off here
Mhm.
in this communication. And, I've had this thing where I'm like scouring the chart. I was like, what is going on in the
Yeah.
past medical history? And there's nothing there. And you're like,
Uh-huh.
oh, who knows? But
Mhm.
but also, in your everyday life, my administrative role in our company, like
Mhm.
where you're communicating with someone and I'm having this thought where there is I think there's lots of people out there that are on the autism spectrum who are not
Mhm.
diagnosed and are
Yes.
unaware that this
Mhm.
is a a thing.
Yep.
Um,
Mhm.
and how do you suggest bringing that to someone as
Mhm.
as well, there's one as a clinician, like
Yeah.
I well, excuse me, sorry,
Mhm.
I'm more comfortable with that than I
Uh-huh.
am like in a normal social setting where
Yeah.
I'm interacting with somebody who clearly has some, I don't want to make a judgment, but they're having
Yeah.
difficulties with communication in the normal
Mhm.
construct of the world.
Yeah.
Um, but how do you suggest bringing that to them, I guess?
Yeah, yeah, and this is one of those things that can be really challenging, and it really, it's frustrating that it's challenging because the main reason that it is, or that we as providers, or even especially in our just like personal life, um, are weary to, is because of the social context that diagnosis carries. Still, again, like that a lot of people can be really uh I actually, when my own psychiatrist told me, she goes, "You may want to fire me for saying this." And I was like, "God, what is she gonna say?" Like, and then she was, I think, I think maybe you have autism. And I was like, "Yeah, I
Trying
know."
to brace yourself, like this could go
Oh
poorly
my
for my
God.
whole
Like,
world.
what do you see? Like, oh man. But then she said that, and I was like, oh, yeah, okay. Like,
Oh, right,
that tracks.
that well, like, I mean, I would
Yeah.
imagine.
Uh-huh.
I
Uh-huh.
mean, I guess it depends on the person and what their experience of the world has been up to that point of hearing that, but,
Mm-hmm.
um, I think for a lot of adults hearing like, "Hey, I think you may have autism," might
Uh-huh.
set them back. It might not. I guess it depends on, yeah, a
So
lot.
I think for a lot of us, like, I actually think why she remembers me being kind of emotional at first. And the reason I was emotional though was almost more from this, like, oh my God, like you saw it. Like you see it. Like I thought it, just like that again, I was like so good at masking that it didn't really matter, that I didn't like need help with anything. I didn't need to be understood anymore. And I was
Mhm.
like, no, but like I'm like really high masking. Like nobody knows this about me. It's kind of like this hidden thing. Like nobody would know. I'm great at communicating. I'm great at all of these things. So that was really the shock, was that she saw it and she knew. But I found that most of the time when most people are not going to respond. If they really are and they already see that in themselves in any way, they probably are going to respond okay. If they lack a lot of self-awareness and don't, then they may not necessarily so. But if I'm going to bring it up to somebody, the way that I tend to do so is usually I'll just ask them something like, um, have you sometimes I'll at least start with just some of these criteria. Do you relate to any of these things? Like talking about sensory sensitivities and kind of get them kind of talking about this, like, tell me about this, like with yourself. And then usually if we kind of get enough, like, yes, 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 those type of questions, I'll say, have you ever thought about, or have you ever looked into relating to the autistic diagnostic criteria?
Mhm.
Um, and I'll usually kind of be really, "Hey, you may not meet all of these, but, like, let's look at these and just tell me which ones feel like you." And I don't get hung up on having, if they don't want to get diagnosed, if they don't wanna go through the diagnostic process, if that does not feel helpful to them, fine. What I just like is I feel like it's another tool to know yourself and
Mhm.
to learn, ways to maybe help yourself in situations that may have been challenging for you, or just validating.
Do you, it's something I done over the years, but I want to see if this lands for you on a clinical perspective. And when I'm interacting with a patient and I'm concerned about this,
Mhm.
I have historically brought it to them as not autism because that carries such a, like people think of Rain Man, they're thinking they have, and they're mostly thinking of kids. And what I've brought to them is having sensory processing disorders.
Yes.
And because most people don't think of it that way, but historically, when I brought it to them of like, like, are you, and then I bring in the
Mhm.
symptoms to them of
Yep.
that. And
Yep.
oftentimes when this has happened, it's something has landed with them.
Yes.
And then my next step has
Mhm.
been
Mhm.
to say, so some people get evaluated for this because then they can figure out what tools they can put in their toolbox to approach the world when they have a problem.
Yes.
Um, and so
Yes.
that's how I brought it. I haven't brought it as autism specifically,
Mhm.
mostly because of the social stigma.
Completely. And, for me, it is probably a little bit easier because people are coming to me already with that thought because, like, they know they're coming to somebody who works with, like, neurodivergent people. So, like, that is different. But I think that's a great way if you're like a general provider, kind of like prepping it as a sensory processing disorder. And here's the deal. It could be just that. Like, again, there's so much around autism that we don't know. Again, like you mentioned that, like, I also have hypermobile Ehlers-Danlos syndrome. So sensory processing disorders are really common in HEDS. So honestly, like, do I have autism or do I have a sensory processing disorder secondary to having HEDS? I
Mm,
don't know. We haven't really nuanced what autism is enough to know, like, what different buckets maybe each of us fall in. And are we catching people sometimes in that autism net where it is a sensory processing disorder? And maybe there are differences between me and, you know, the Rain Man. Even though, like, I see some similarities in myself there, especially, like, certain areas where my brain really, like, um, hyper focuses in on things, and, areas where it really highly excels, and then on the other side of it, areas where that it really maybe struggles. Um, but yeah, maybe there's I think that there has to be more of a difference, than we know. Yeah.
well, it's interesting because, I mean, for me, I work with a lot of patients who are really high functioning
Yeah.
individuals.
Mhm.
Um, but so, in the general world of success or whatever
Mhm.
we call success in the world, whether it's financial or sports or whatever,
Mhm.
it's it's it feels sometimes that there's a greater preponderance of sensory processing disorders or autism spectrum with a lot of my patient population,
Yes.
and figuring out ways to bring it to them because oftentimes they're coming to me because they're trying to better their lives. They've
Yep.
gotten to a successful point where they want to pivot in their mind. They feel like this is the right thing to do to start
Mhm.
pivoting towards um, legacy or those sort of, and
Mhm.
taking care of themselves and seeing what they want to do in the future.
Yeah.
Uh, and this is a way I have to sometimes we have to bring stuff to them so they better understand themselves so they can address barriers in their life that they've come up to. Um,
Yeah. Well, and I think it's so important because, like, so when you think about sensory processing, for these patients and they're trying to improve their life, if you are not aware that you have differences in sensory processing, it's going to be really, really difficult for you to have that high quality of life. I mean, sensory processing, I mean, that's how you understand your entire world.
Okay.
So, like, if you're in a room, like, with your dog and you both are just, like, chilling, feeling really at peace, nervous systems are nice and calm, but then your dog starts freaking out and, like, barking at something, and you're like, "I don't know what you're barking at. Everything's fine." And you're like, "Hey, like, let's be quiet, whatever." You guys are both having different sensory experiences in that space. Your dog may be hearing another dog barking to streets down, you can't hear it. But neither sensory experience is wrong. They're both right. They're both real. They're just different. And if you are an adult trying to have a high quality of life, and especially again, I find this with my undiagnosed autistic adults, is they are trying to base their quality of life off of the context of others, not off of their own context. Because if you were not diagnosed or you were not identified as having these sensory differences, you were told lots of things from the time you were tiny that the context through which you understood the world was wrong. So like, no, Kalin, your shirt's not itchy. Like, go to school. You're fine. Like, even though I wanted to like rip it off, or my socks, the line on my socks had to be at a very specific point on my feet.
Yeah.
And I would
You
have an
want too much
absolute
pushing on
tantrum.
that pinky toe.
Yeah,
Like, much on that
exactly.
pinky toe, man. It would drive you crazy.
It's awful. It's all you will feel then if you have, again, hypersensitivity to touch. And yet, like, that wasn't understood by the adults around me. And so they were just basically, unfortunately, communicating that, hey, Kalin, your context isn't correct. So a lot of especially undiagnosed autistic people end up being people seeking things like, hey, help me improve my quality of life, or buying up all the self-help books because they're still looking external to themselves like they were always taught to help make me feel better, when really what they need to understand is, hey, I have these differences in sensory processing. What I really need to work on is my own interoception, my own trust in my own experience, and how do I accommodate that?
Mm. So it seems like one of the things that's happening, and this is kind of the next leap for me, intellectually, is we're developing more effective strategies for people to be able to regulate sensory processing disorders. So,
Yeah.
what sort of strategies are you seeing now that are new, different, and really helpful to patients?
Yeah, yeah. So a lot of times when doing so, I'm usually starting by going ahead and identifying um where they land in the hypo and hyper aware, or hypo or hypersensitive in the different areas of sensory processing, like starting with that. And then from there on out, a big part of it is really helping them develop that interoception and that proprioception. So even again, their ability to notice those things. So that's a big problem, especially with people with sensory processing disorders, is just even their own attunement to what their own symptoms are, of that, and like really helping them understand. So one example that I see a lot of times actually in autistic patients is when they have low blood sugars and they're hypoglycemic, right? Hypoglycemia is a big dysregulator of the nervous system. And I see a lot of my autistic patients have way worse overstimulation when they're also hypoglycemic, when they're hungry, when they haven't eaten. And yet they don't get normal hunger cues, or if they do get them, they don't notice them. So it's also a big part of it is just helping them to kind of come up with this list and identify, hey, I know that I need to eat when I start knowing that like all sounds sound incredibly loud and overwhelming to me, that that's actually my sign of hunger rather than my belly's growling. So the biggest thing that I found that really works is me helping helping them to basically identify what all of these things look like in their body.
Mm. So, um, so it sounds like you feel like there is value when people, there's a concern for sensory processing, some sort of sensory processing disorder, in getting evaluated long term for people.
Yes. Yes. Yes, for sure. And getting evaluated, or at least if nothing else, like um doing some research, or as a provider even just sharing information on like what that is and things that you can do to kind of help accommodate those things, and even just stressing to the patient that this is something that's okay to accommodate. Like there's so many patients who just feel like that um something that they shouldn't do. I had a patient one time who was a provider themselves, had come to me and wanted to get to the gym more. That was actually their thing. Like, they were ADHD autistic, and they were like, I just can't get myself to do it. And so I told them, hey, give it a try, report back to me how it went. They were like, it went awful. I was like, okay, what happened? Well, I got in there and but it wasn't cool enough. It was too hot and I was really, really sweaty. Well, okay, you get sweaty in the gym, but all right. But I was like, why did you like that? Well, I didn't like the way it felt. I got really itchy. Okay. And then what happened? Well, then I went to go squat and the bar was sticky. Okay. And then I went to go pick up some dumbbells and those were sticky. Okay. And then I was hot and my ice had melted in my drink. I'm hearing all of this and I'm like, whoa, okay, we've got some major physical sensory barriers here. That's really why the gym is so terrible for this person. And I was like, okay, well, what if you bring a little fan with you? What if you bring a extra water bottle with just ice? What if you bring towels to wipe off the bars? And he was like, yeah, okay. And finally, he kind of broke down and started crying. And he was like, but fix me. Like, I need to be fixed. Like, make this stop, make this go away, make this not something that bothers me anymore. And while there are things that we can do to help increase some tolerance towards those things, a big part of what I find is also just accepting that, like, this is the way that your body experiences these things. And maybe that's okay that you go to the gym with an extra towel to put on the bar, if that helps you move closer to your quality of life.
Yeah. Well, it sounds like it's a lot of identifying barriers and coming up with solutions to those barriers,
Yep.
but it's, for people who are in it, like, and having that experience, it's really hard to see. And some of those examples, you're like, somebody may be listening to this and being like, yeah, that's a real obvious solve there.
Right.
But if you're in that situation, not so.
No.
And it's a
Well,
challenge and it feels overwhelming.
and I think one of the big challenges actually is that second piece of information, just social context. So this patient was one though who was autistic, but was also very aware and very, very concerned. So one of the things that's really common in autistic people is also rejection sensitivity. So very sensitive to being rejected. Really common in ADHD as well. So doing something, asking your patient an easy fix, bring a towel, sounds easy, but you're also telling a patient, show everyone that you're different in this room. And that is a huge, huge anxiety producing burden that you can also see then exacerbate lots of other possible disease states. This patient also had some like cardiac issues and whatnot. And like, so yeah, if I'm going to ask him to do something, that's going to increase his blood pressure, increasing anxiety. Like there's other consequences to that too. So easy in um, the idea, but in the actual application of it, actually really, really challenging.
Yeah. And it's funny because this can present as almost like social anxiety,
Yeah.
for people, and I've certainly had patients where we've felt that this was social anxiety, but the more we got into it, the more like, no, this is a sensory processing thing,
Mhm.
and but you're worried about, whatever that looks like, which is a little different
Mhm.
than social anxiety, and the
Yes.
solve the solve around that is different. And so that's why
Yes.
knowing the kind of nuances there and the difference is important for to help problem solve. So that's why I kind of like am pushing people and patients of mine to get evaluated around
Mhm.
sensory processing with somebody who knows what they're doing,
Yep.
and get a because then we can help, like, come up with effective strategies,
Yes.
for regulation around that.
Yes. Well, exactly that. That, yes, somebody who doesn't want to go to the party because they are afraid to talk or, have fear around talking to a person versus they don't want to go to the party because they're overwhelmed by where do I park? And like, where is the house? And like, where's the bathroom when I get there? I have
Mm,
like one patient, like,
rough.
that is the thing. If they don't know where the bathroom is, like, the amount of anxiety that like causes them, like, is everything. And that, okay, sure, that could just be anxiety around that one thing, but it's really more actually again around the autism of knowing how they're going to meet their needs
Yeah,
is a big struggle for their sensory sensitivities.
yeah, sure. Um,
Yeah.
well, Caitlin, so where would if somebody's listening to this and they're like, "Oh, I know somebody who really needs to talk to you or somebody else,
Yeah.
or themselves, how would they reach out to you, or what would you advise
Yeah.
they do locally in their area? Yeah.
Yeah, yep. So they can definitely reach out to me. I'm always happy to help walk through evaluation processes and also ways to manage and work with these sensory sensitivities or identify what we think is really going on there. So for that, they can definitely hit me up on my website, which is kalinjohnson.com. Also find me on Instagram and TikTok at KalinPharmD, where I like to post information about this and kind of just more examples of what this may look like to see if it's something that maybe you do relate to. And then in your own area, um, you can definitely reach out to your local psychiatry, psychology offices. They usually are going to be where you're going to go through the classic diagnostic piece for that. Your PCP would be a great referral source for that. You can definitely look up through any of the autism organizations as well, some local providers. Not a whole lot of people who do exactly what I do, doing the neurodivergent coaching. There may be somebody in your area. Google search for that for sure.
Yeah. So like the National Autism Association
Yep. Yep.
is a good resource.
That's a great source. Yep.
Cool. All right. Well, Caitlin, it's always good to see you.
Yeah, it's so good to see
Congratulations on
you.
the baby. It's
Thank
awesome.
you. Thank you
Yeah.
so much. I appreciate it.
We'll have you back sometime, talk about something else.
Oh, yeah. Oh,
All
yeah,
right.
for sure.
All right.
Awesome. Thank you so much for
All right.
having me.
No problem.
Bye.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.